Good morning, it's 11:20 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak. And here is Health Minister Bang Neung-woo briefing us on the current COVID-19 situation from the Seoul government complex. Let's take a listen.
And the total number of confirmed cases now stands at 12,003, and a total of 1,057 people are in quarantine undergoing treatment. The death toll now stands at 277, and unfortunately we had one more fatality yesterday. I extend my deepest condolences to the deceased and the members of the bereaved family. Today, the government held a meeting presided over by the Prime Minister Chung Se-kyun, and we discussed issues of intensifying quarantine measures in the metropolitan area. And the risks of infection in the metropolitan area continues to rise. They range from religious small group meetings and door-to-door business establishments, as well as indoor table tennis clubs, and this has risen to and extended to other cluster infections. And last week, we had also an average of 39.6 people on average. And this week also, we have 40 to 50 daily confirmed cases. And during the past 2 weeks, out of the entire confirmed cases, 96.4% of the total were clustered in the metropolitan area. In particular, we see cluster infection, and since we have the first case of cluster infection, we have a very high speed of infections and transmissions, leading to third-hand and even fourth-hand transmissions. And we also have put in place administrative orders. However, we still see an increase of transmissions that are happening at venues that are on the blind spots of our quarantine measures. And 2 weeks ago, we aimed to curb the local transmissions, and therefore we intensified our live quarantine measures here in the metropolitan area. And areas of venues including the PC rooms and singing rooms and 8 other high-risk facilities, we have mandated all of the people to have a QR code-based digital entry log. And we also suspended the operation of public venues as well, and we postponed and cancelled unnecessary gathering events held by the public. And on a pan-government initiative, we also carry out on a daily basis inspections on these multi-use facilities, and on multiple times we also have urged the public to refrain from using these public facilities. And thanks to these efforts, we are yet to see a massive outbreak. However, the speed of the quarantine is still behind the speed of infection of the COVID-19. And we could at any time have a high risk of infections, especially when the cluster infection begins at a facility where quarantine measures are not kept very well. And last week, we also had a major accomplishment of resumption of all grades levels back to school. And however, if we have the intensified and exacerbated situation of COVID-19 outbreak, we need to also roll back on our measures and go back to online classes. And to this end, we also decided to extend the intensified live quarantine measures in the metropolitan area to intensify our quarantine measures. And in order to minimize any of the social costs and social harms that could arise due to an intensified social distancing measure, we have made such a decision. And this extension would not have a specified due date. However, it will be lingering on until we manage the on-day increase to a single digit. And to this end, we will extend our conventional quarantine efforts and measures, and we aim to decrease and curb the further transmissions of the virus locally. First of all, we will delay the speed of infection, and we will take a closer look at the vulnerable places with weak quarantine measures, and we will take preemptive measures for these places. And these places would being under these targets will be extended from the current 8 high-risk facilities, and plus we will also look into our quarantine blind spots as well. And under the Penn government initiative, we will do a major crackdown and inspection on these business establishments. And if there are breaches of quarantine measures, they will be faced with grave legal consequences. And we will also include the thinner masks, which are better for the public to breathe in hot weathers. And we will also put in place administrative orders as well. And we will also put in place measures and policies that will increase our speed of tracking down the patients. And we will extend and mobilize more people who will be working as epidemiological investigators. And we will be cooperating with a police department as well. And we also have an extended use of QR code entry logs. And they will be also mandated to the private academies, as well as PC rooms and other facilities here in the metropolitan area. And they would also be extended to other facilities as well going forward. And we will also look into the diagnostic testing of people who are living under poor conditions, including a single household of elderly people who are living together, as well as the 고시원, which is in a very cluster area of people who live together as well. And we will also prepare for a possible shortage of the lack of hospital beds in the metropolitan area. And we will also preemptively designate a live treatment center here in the metropolitan area to respond to a possible lack of hospital beds. And we will also intensify our support for the medical staff who are fighting on the front lines and who are undergoing a very hot weather. And the government has decided to also adjust the working hours and working operation time of these screening clinics. And we will also implement air conditioning at these facilities. And all of the medical staff working at these screening clinics, they will be advised to use 4D and other types of equipment, personal equipment gears, rather than the equipment that they are using right now. And these are also under the guidelines put in forth by the WHO as well. And going further, we will also listen to any of the opinions from the site. And we would like to extend our deepest gratitude to all of the medical staff members who are exerting their full efforts fighting against the COVID-19 on the front lines. And we also have 4 more messages for the residents living in the Seoul metropolitan area. Currently, we are at a very critical moment. We understand that you are going through fatigue time. However, we ask you to continue to stay vigilant. We need to have you understand that you are the most effective quarantine agents. And despite our government measures, we did not see a big drop in the number of and the amount of foot traffic. And compared to previous weeks, the movement of last week was about 96.9% of the previous weeks, meaning that there were no big differences. And if we overcome these times of difficulty successfully, we will be having a new future in the future. And if we fail to effectively react to the outbreak, we will also face dire consequences, including returning back to the online classes for our kids as well. And we also would like to advise all of the residents to avoid any of the social gatherings and meetings if they are unnecessary. And please refrain from going to public venues as well. And we also have messages to all of the managers and operators of business establishments. please understand that if you have strict quarantine measures, you could minimize the risk of infection. And I believe this has been a common sense to everyone. And remember always that COVID-19 can spread at any time at any venues. And please understand you need to take good care of your establishments with quarantine. The government will work closely with the local governments, and we will put pan-government initiatives to overcome the virus. We will continue to carry out inspections on the nightlife entertainment venues. We will carry out swift testing and extensive testing and contact tracing. And we will also provide increased support and compensation to the medical staff who are exerting their full efforts on the front lines. So we ask the public for your participation. Please have a sense of responsibility at all corners of life, and please join our efforts in fighting the COVID-19. And in the end, I believe and I'm confident that we can have a safe future. Thank you very much.
That was a live briefing from Health Minister Bang Nung-ho updating us on the COVID-19 situation in the country. He just told us that there were 56 additional cases of COVID-19, bringing the accumulated total to 12,003. There was unfortunately, however, one extra death, bringing the total to 277. That wraps up our coverage of this morning's briefing. Thank you for staying with us, and we'll be back shortly with our regular newscast at midday Korea time. Bye for now.